Since my surgery with the ReSTOR, I'm ready for anything. I'm 100%. Bring it on, we can do it.
When I get up in the morning now, I can read the paper. I don't have to have glasses. I don't have to have more light.
If there is just one thing I could say to anyone who is considering this surgery, is go for it.
As you can see, the ReSTOR is beginning to change people's lives. Yours can change too when you can see clearly again, while reducing your dependency on reading glasses or bifocals. My name is Susan. I recently had cataract surgery to correct my clouded vision. I found that having a cataract prevented me from enjoying a lot of the activities I had participated in throughout my life. Even driving at night was a concern because of my blurry vision. Now that I've had my cataract surgery, I not only can see objects clearly again, but thanks to a unique new lens my doctor told me about, my near vision is better too. Like many patients in the ReSTOR clinical trial, I no longer need to hunt for my reading glasses whenever I read a book or do my artwork. And since my surgery, I love sketching without my glasses. A miracle? No, not really, but it has significantly improved my life and the quality of my vision. Since my cataract surgery and receiving the ReSTOR lens, I can do all my favorite activities without the burden of reading glasses or bifocals. Before my surgery, I needed glasses for just about everything I did. At work, at home, even going shopping, I always had to remember to bring my glasses. But my reading glasses weren't useful when I had to see something far away. Playing golf and tennis, which I love to do, weren't as much fun anymore. But more importantly, I noticed changes in my vision. My vision was blurry, even with my glasses. It was making even the easiest things like cooking difficult, reading the recipes, the labels, even the ingredients. One day I was putting together a toy with my grandchildren and noticed that even reading those directions was a struggle. Driving at night was also a problem. I noticed that oncoming headlights had an exceptionally strong glare. They seemed to blur together. That's when I decided to see my doctor. During my exam, he discovered I had cataracts, which was why my vision was cloudy. I was concerned at first, but he explained that cataract surgery is the most common procedure performed, with millions of patients having their vision improved each year. My doctor told me that our eyes work much like a camera. Light passes through the lens of the camera and is focused on the film. Our eye also has a lens. Normally, this lens is transparent and lets light pass freely to focus on the back of the eye, called the retina. My doctor explained that a cataract can be the reason sharp images become blurred, or seeing things at night is more difficult. It may also be why the glasses or contact lenses that used to help you read or do other simple tasks no longer seems to help. Another aspect of the eye that you may have noticed when you reached your mid-40s is that you had to hold things farther away from you in order to be able to read clearly. I sometimes had trouble seeing the details in the photographs I was sketching. I was told that what was happening is a natural part of the aging process. As your eye ages, it loses the ability to see near objects. This is known as presbyopia. He explained that the treatment for a cataract is to remove it and replace the clouded lens with an artificial lens. Until now, cataract patients could only receive lenses that replaced the cataract, but still required them to use reading glasses or bifocals for close-up activities. My doctor told me about a unique new lens that provides a full range of vision to cataract patients. He said cataract surgery has undergone amazing advances, and that with today's technology, the goal is not just to improve distance vision, but to provide that full range of vision with an intraocular lens, effectively reducing dependency on glasses. He told me about the ReSTOR lens, which delivers a high level of freedom from reading glasses or bifocals for cataract patients. My doctor said the ReSTOR IOL would allow me to see objects at a range of distances. He said the ReSTOR lens also provides sharp vision in all levels of light, from bright daylight to nighttime. He said some patients notice rings around lights at night. The unique apodized design of the ReSTOR lens is designed to reduce the effects of glare and halos. I was told that nearly 94% of the patients who had the procedure done were so satisfied with their vision, they'd repeat the procedure. Getting rid of my cloudy vision and being free of my reading glasses sounded too good to be true, but my doctor told me that most patients who have undergone the procedure are very positive about the experience. Some even described it as life-changing. I was told that 20% of the people who have had this procedure done still use glasses for some activities. I discussed it with my doctor, however, and we agreed it was the right decision for me. Well, I decided to do it and made an appointment to have the procedure done. The day of the surgery, the nurses explained in detail everything that was going to happen and gave me a sedative to help me relax and medication to prevent discomfort during surgery. I was very comfortable throughout the procedure, and before I knew it, it was over. In fact, the whole procedure took less than 30 minutes. Here's how it works. The doctor will make a tiny incision in your eye and perform a procedure that uses a small instrument about the size of a pen tip to gently separate the cataract into smaller pieces and remove them from the eye. Once the cataract is removed, the ReSTOR IOL will be inserted into the eye. Once in your eye, the lens gently unfolds and is set into its permanent position. After the procedure, you'll rest for a while in the recovery room. You will be given prescription eye drops to guard against infection and help your eyes heal. You will also be given a protective shield and further instruction on how to care for your eye over the next few days. I'm told that most patients see well enough to resume their normal routine the next day. After surgery, some patients may notice rings around lights, but for most patients, this diminishes over time. Most patients report experiencing a full range of vision from the ReSTOR lens soon after surgery. Doctors recommend that both eyes be treated to experience the full benefit of this breakthrough technology. Since my cataract surgery, the quality time I spend with my grandchildren is so much better. My whole life is so much better now. My cloudy vision is gone, and I no longer have to search for reading glasses or remember to bring them with me. My vision at all ranges is crisp and clear, and I'm having fun doing all the things I love. I'm so glad I had the procedure done, and my doctor tells me my experience was typical. Only you know whether you should have the surgery, but if you'd like to reduce your dependence on glasses after cataract surgery, ask your doctor about the ReSTOR lens and get all your questions answered. My cataracts were treated, and like the 80% of ReSTOR patients in the clinical trial, I don't have the burden of reading glasses anymore. As you heard in the beginning of this video, others who have had this procedure done say, go for it. Life without glasses sets you free. As with any surgical procedure, there are risks and benefits. Please thoroughly discuss the brief statement with your physician.